that was really awesome. We talked about really the health benefit of prehabilitation and rehabilitation and getting your body ready for kind of like the marathon that sometimes accompanies a bladder cancer journey. And then, highlighting the golden rule and, those microbursts and thinking about your self-confidence change. I love the idea of changing yourself, your perception. Are you a person that is, beaten down by bladder cancer? Or are you living well with bladder cancer, and kind of showing people that you're doing everything you can be and really living well and rewriting that elevator pitch? I think we've had quite a few good questions that have come in, and really they're across the board in terms of who might be the one to address. Some were really sort of focused on the medical aspect of it. So for Dr. Mossanen, are there any contraindications or concerns about doing strenuous exercise like running while in the middle of a BCG therapy, in the sense of that? Or is there, any warning signs that people should be looking out for if they're having intravesical therapy and they notice blood in their urine if they go out and do something strenuous? Is there something they should be paying attention to?
I think it's okay to exercise while on BCG therapy. In fact, it might be helpful to cope with some of the side effects. If you're noticing that you're having bleeding, though, you might want to reduce your activity, increase your hydration, see if it improves. And of course, I'm obligated to say contact your doctor if your symptoms don't improve. But I think that even moderate activity, could be good to help deal with some of the side effects of therapy, like the bothersome urinary issues that patients might get. So you might not be able to do the most intense exercise, but as we kind of discussed, a micro burst of activity or something, just some movement is better than no movement. So I do think it's okay to be active and to do some exercise during intravesical therapy.
Great. And we will have a question about the BCG in just a moment, but let me just ask another follow-up. How soon after TURBT do you, and in general, do doctors suggest people wait before they go back to doing real physical activity or exercise?
That's a great question. It depends. If it's a small, little 1 centimeter tumor that's been plucked and cauterized, then maybe within a couple of days, patients can get, back on their feet and back to their regular exercise program. If it's a large tumor that required a very extensive resection and a catheter to help the bladder recover and heal, then you might have to wait. So it really depends. But I think even no matter which procedure you've had, getting up and walking immediately after surgery is very important for numerous reasons. So I think getting active is sort of the key theme to emphasize. The degree to which you can really push it, if you really are that active and very eager to get back to your regimen, I think you just talk to your surgeon so that they can communicate how big the procedure was.
Okay, that's a good point. So Scott, when you went through your treatment, you had BCG, correct? So were there any side effects that really impacted you in terms of things that you experienced that perhaps, you found a way around them? Dr. Mossanen, you were just talking about, things that you might be able to do to mitigate side effects, but, what kinds of things in particular, like if you had burning with urination, obviously you would be hydrating more, but was there something exercise-wise that might have helped that?
Yeah, so it's an interesting question. One, it was exercise that made me realize I had a tumor to begin with, right? So like a lot of things, I had blood in my urine after a really hard workout. And first I Googled it and thought, Google just says it's because of my hard workout. Well, then it came back a few more times and that led me down the path of finding it earlier than I would have otherwise because of exercise. So that was a good thing. After the resection, I think I had a catheter for 6 days, and that did keep me from going to the gym. I don't think I didn't feel up for it. I'm sure no one else wanted to see me come to the gym with a catheter. But 2 weeks after my resection, the doctor gave me the okay to start working out and in the gym, and I actually felt very strong. Now, when the BCGs, when I started those treatments, and the side effects built up a little bit more over time, which I guess is fairly common. I found that I would be tired for about a day. So I wouldn't go and do, if I usually tried to schedule it for Friday afternoon, and then I would just take Friday afternoon and Saturday off. And then Sunday I felt pretty good again, and I was able to start exercising a little bit more and all that. There was one time where I decided to push it and exercise and work out anyways, the morning after my BCG treatment. And what I found was interesting is it wiped me out for a few days. So for me personally, right, every case is different, right? I mean, we're all unique, just like everybody else, kind of thing. But I found that if I gave myself that day to rest, then I was able to start exercising, pretty effectively the next day after that. But it didn't, other than that, it didn't slow me down. I did change my workouts. I stopped doing, at the advice of one doctor, and I stopped doing really long cardio. I stopped doing endurance work and focused more on short. Even when I'd go out and run, I'd run short sprints versus trying to do long distance. And that seemed to work for me.
So Mark, I have a question for you, kind of to follow that up and put that mental health piece in there. So when you're experiencing side effects, that can be very uncomfortable or challenging, how do you continue to reframe your selfie, your elevator pitch to make yourself get through those? And, what do you suggest that people might be able to do to help change the little script that's playing in their head when they're experiencing discomforts and pain because of the treatments that they're going through?
Well, my experience is if we can start to kind of do different things, little things, like go to some place you haven't been before, talk to someone you haven't, get your mind into that new frame. You have to really begin small steps to get away from that. Go to an art exhibit. Talk to someone you haven't talked to before. Talk to them about what's going on in your life. Talk to them about what you like to be. It's really a matter of trying very hard to do something you haven't done before.
Okay. Yeah, go ahead, Scott.
Yeah, sorry, Stephanie. One of the things that I just want to make this observation about participating in the master sports, whether it's swimming or track and field. I noticed when I went to my first national meet after my resection, all of a sudden I was aware of all the other things that older athletes are going through. Right. So, I had the bladder cancer, but there was the guy with the new knees and the person with the, shoulder surgery or the replaced hips and all that. And it made me realize as we get older, our fitness goals are really a little bit of a constant recalibration to the situations we find ourselves in life. So it was very helpful for me to see that, yeah, there's a lot of other people who are going through their trials and tribulations and things they're having to overcome and staying active and encouraged and enthusiastic about being fit.
Yeah. Dr. Mostyn and I have a question. A lot of patients who do end up having a radical cystectomy have ileoconduits, and that, of course, could lead potentially to peristomal hernias. What are the things that you, as a healthcare provider, might suggest a patient do to reduce that risk or adapt in such their desire for getting back and being active in such a way that they can do that, but maybe not risk a peristomal hernia that could occur because of the conduit that they have, the type of urinary diversion?
It's a really good question. I'm thinking of a couple of my patients that are very athletic, yoga instructors and heavy duty cyclists. And so I will sometimes recommend that they get a support belt and wear it, and it can be customized for the stoma, and they can work with an ostomy nurse to do that. And I usually have them put it on when they're doing their activity. And a key thing is to really not let the body heal after the cystectomy. So I really encourage them to be patient and let their body heal for at least 6 to 8 weeks before they really want to go after heavy activity, even sometimes 3 months. So combination of the belt and letting the body heal are some of the suggestions for helping to reduce that.
Right. So now, maybe you can recommend a little micro bursts of particular little areas that are not necessarily going to impact where the stoma is in some way. So now you've got a new way of thinking about that. So this is great. So have you thought about, are there any concerns about bike riding? Because that's certainly, with other types of cancer like prostate cancer, that certainly can have an impact when you're riding on a bicycle and everything else. Have you seen anything, or do any of you know anything about, alternative, not just running or being an athlete themselves, but, in the sense of using equipment like a bicycle to exercise, or a treadmill for walking, those kinds of things? Any suggestions?
I'll just make a quick comment. I think we're sort of with, like, the rest of the people on this panel are highly competitive, established, accomplished athletes. But many people with bladder cancer are dealing with other health problems,
Good point.
or they were former smokers and their lung function is not great, or they're in the middle of chemotherapy. So I think that my guess is that, and I really want to hear the other guys make comments too on this, but is that most patients with bladder cancer will benefit from just 20 minutes of walking a couple days a week. If we're getting to the point where we're doing a highly vigorous, like, bicycle riding, then I think you might want to have, like, a one-on-one conversation with your urologist or your medical oncologist or whoever it is about the degree of activity and some of the symptoms that you may or may not be connecting with that exercise. Just wanted to put that little comment in there.
Yeah, good point.
Well, I'd like to jump in here just for a minute, because I have a client. As a personal trainer, my clients, my bladder cancer clients, are at all stages. And I have one client who and he's on the call now, and I'm pushing him to do a triathlon because I'm an Ironman triathlete. But if you manage it properly, and if you can manage the stress, Dr. Musman, you can correct me on this, he knows his limits. We ride 30, 40 miles at a time. We run once a week, and we're running 6, 7, 8 miles. We're in the pool. It's his weakest point, but you can do it. If you manage it properly, you understand your limits, and you understand the implications, possible implications, there's not much you can't do. I've seen it firsthand with my clients.
And Stephanie, and I agree with what Mark is definitely saying, and it sounds like certainly a lot of wisdom coming from Matt. One of the things that I've done, and some people that I've worked out with, is we've had ailments and we wanted to get some walking in, but maybe we didn't have that much time to go for 20 minutes, or we wanted to have a little bit the feeling of support, is I'll walk in the pool. It gives me some resistance, but gives me support as well. And I feel like I can get some work in without actually having to get, go on a long walk or a long run. So just a little tip of, it's a little bit like a microburst, right? Just walk in the pool, not over my head. I'm tall, so it makes sure it's only in the shallow section. But I found that to be really a good way to get some endurance work in without overtaxing my body, and giving myself some support as well.
Right. Yeah. So I think it's important to remember that just because you're paying attention on this program or you're watching the recording, you're not suddenly going to be a competitive athlete at age 65 if you didn't start as a competitive athlete your whole life. It's not going to happen right then, but you are able to build exercise into your day, fitting into your signs and symptoms and treatment. As Dr. Mosman is saying, always check with your provider, make sure that they know what you're doing, so that if you end up with any problems, they know how to help you, I think would be a really good point. And that it's not just physical, but it's also very mental. And those are some things that all lead ultimately to wellness and thriving and doing well. So those are some key points that I think this webinar really brought out to me as, you know, a participant on the webinar. Do you all have any other closing comments? Because this has been phenomenal. And as I mentioned, I think, Scott, I'd love to get some pictures or links to any of the other exercises, and Mark too. We can put the links into the transcript as we create that and we post that on our website. I think it'll be an invaluable resource for a lot of patients.
You know, I would just like to make another comment on this pro athlete issue. I think it's important. Most people are not the kind of athletes that we are on this call.
Mhm.
Most people, as you said, you know, if they can do the recommended required minimum daily requirements, they're lucky. I really believe that it's equally as important to step away from that for a little bit. Yes, as Dr. Newsman would improve, exercise is critical before. You've got to be in the routine. The better shape you're in, the easier the procedure is going to be, the easier it is, your recovery is going to be, the quicker you're going to get back on your feet. But most people need to get through that. They're not like we are. So one step at a time. Think about yourself and think about your elevator pitch, think out of the box, and make yourself realize how important this exercise is. I think that's very important to get away from Scott and myself, who are, you know, just below pro athletes. It's not reality for most clients.
Right.
And I'd like to piggyback on that, echo it completely. You know, one of the things, the people that have gone through the microburst workouts, right? It's a flat resistance band. Any of us that had any health issues as we've, you know, matured through life, we probably have a resistance band from the PT somewhere. But if not, you can get one easily. And the people that we had go through our program were all ages. You know, and it's really interesting, the story. One guy finally got his 90-year-old father working out with him doing these, because again, it's so easy. But you'll really feel, just to add a little bit of resistance with the resistance band to any movement, even if you're walking, right, is just a great way to get started, no matter what level you're at.
Super.
Oh, by the way, did anyone take the selfie I asked for? Did anyone redo their elevator pitch in the last 15 minutes? Just curious. I promised you.
Raise your hand if you did. There's a little
somebody.
raise hand button. Let me
Did
go
you
to
get
the
any?
participants and see if anybody's got their hand up.
Come on, somebody raise your hand.
I did.
Scott did. Scott rewrote his.
Yep.
So Scott, what's your new elevator pitch?
I love me some me.
Yeah.
No, it was really, you know, grateful to be here and living heroically.
Yeah.
You know?
Excellent.
Which I guess I didn't really rewrite it. I've been saying that for a while, but I wrote it again.
Well, this is good. So I think, you know, absolutely one of the things that I think you've done, Mark, is you planted the seed. People are going to start doing it. They're not going to do it right away to share, especially with the Zoom. I haven't seen anybody with their hand up. However, I hope you planted a few seeds. And we started, and we should always wrap up with a medical perspective. So Dr. Mossanen, what have you got to say to wrap us up?
Oh boy, I think it's been a very nice opportunity for me to learn from these two guys and go through all the benefits. But I think it's just the most basic thing I can say is that some activity is better than none. And most patients are dealing with bladder cancer. It's a heavy thing to carry. So just even if you're getting out there for 10 minutes a day, it can help. So just get out there and move. That's my final comment on all this.
It's a great comment.
Awesome. Yeah, I think that actually wraps it up. I don't see any more real questions. There was just one question. Have the speakers ever seen lesions on cystoscopy caused by exercise-induced hematuria? I've seen a case report describing this and worry that if there are red lesions on the bladder wall caused by exercise, it could resemble CIS carcinoma in situ, and I would end up having to go through a TURP again when that might not be necessary. So Dr. Mossanen, that's a technical question for you. Have you ever seen lesions that were caused by exercise?
I think that's a very unique case.
Sure.
And given that this is a webinar, I think my answer would be probably just go through that with your urologist, because it depends on their history of cancer, the type they have,
Right.
the degree of bleeding and all. And so it's a very good question. I just think it probably needs a one-on-one answer.
Right. And again, when in doubt, they're going to want to check it out and make sure. And it, is it exercise induced or is it a return of a cancer? It's really hard to tell without the microscope. So, again, always refer back to your doctor. So thank everybody for joining.